Heads up, Malachi. Now to our 7 News medical expert. Dr. Cedrek McFadden is joining us once again as we take a look at some of the newest COVID-19 symptoms. So thank you for joining us. These are the things I think we've heard somewhat about. Like you hear stories, interviews done with patients, and they talk about, I first noticed this, I first noticed that.
Correct.
They weren't originally part of the list, but now they're making the list.
So we've heard about the fever, the cough, the shortness of breath, but as we've evolved, we've heard these stories. People have talked about some of these symptoms that we've now had to include in the diagnosed or in the approved symptoms for COVID-19. We're talking about fevers, chills, shaking with those chills, muscle aches. They may even have headaches, or may even find that they have a loss of smell or loss of taste present, or even a sore throat.
I think that's been one of the ones you've heard a lot about in the stories, the loss of taste and smell. I think almost every patient that I've talked to or family member has talked about their loved one experiencing that. So when do these kind of symptoms, the ones that are newer that we hadn't heard about before, when do they show up?
So again, symptoms still take place 2 to 14 days after the exposure. Now there are some symptoms, most of these are mild symptoms, such as, shortness of breath may not be considered the one that gets you to the hospital. But if you think about the chest pain, the chest pressure, the trouble breathing, those are things you have to call EMS for more rapidly than others.
And when it comes to COVID-19 and it being a respiratory virus, we've heard about the loss of taste or smell. Is that something that's to be expected because of what's happening in your system?
So what happens is that the nerves in the nose that carry the sense of what you're smelling, so distinguishing whether or not you're smelling an onion versus an orange, those nerves become infected. And that virus then travels to the brain in that capacity. But again, that doesn't happen in every case, but it can be present.
And what about younger patients? We don't hear as much about the younger patients, but do they have any odd or different symptoms that maybe the adults haven't been seeing?
So there is a phenomenon called COVID toes, where these younger patients and younger children are having these pinkish to purplish lesions present on the toes. It's thought to be related to either inflammation of the blood vessels that may be even creating small clots in these areas. In older young adults, like 40s and 30s, we're seeing more strokes being present in these patients who otherwise don't have any prior medical history or prior symptoms of these types of problems.
And this all gets in with the complication of somehow it impacting clotting in your system, right?
Correct, correct. And that's why we're seeing even younger patients losing toes or losing limbs because of these clotting factors that are present.
Wow. All right, well, what about for the elderly? Anything specific that the elderly folks are seeing as versus others?
So what we're finding in the elderly is that they may not act like themselves. They may be confused. They may want to sleep more. They may want to eat less. They may not be aware of their surroundings. And in some cases, they may become dizzy and may be more prone to fall. So you have to be very careful, and particularly that you're paying attention to the elderly if they're diagnosed.
And why is it important to recognize any or all of these symptoms early?
So when we find that this list is expanding, we recognize we have limited tests. In typical cases, you have to have symptoms to first get the test. So this expands our knowledge of kind of what symptoms brings you to get a test. Additionally, some of these symptoms could be showing that there's a very serious medical condition. With strokes, time is brain.
Sure.
And so if you don't get the doctor soon enough, you could be losing viable brain cells that could cause long-lasting problems after this is gotten over.
Well, we appreciate you letting us know about all of these. We can keep an eye out and know what to ask our doctors about. Thank you, Dr. Cedrek McFadden. Of course, you'll be back live at 5 taking viewer questions. There's a post on our 7 News Facebook page right now where you can add your medical questions, and we'll tackle those live at 5. You're watching Carolina's Family at 4. Stay with us. We're coming right back.